Right, the New Zealand Nurses Organisation, the Nurses Union, is calling for an urgent conference to address the health sector and the crisis that it finds itself in. They're saying the sector is at crisis point, but Health Minister Andrew Little refuses to use the word. Yesterday on our program, he accused the New Zealand Nurses Organisation of opining in Wellington. And when I asked him why he hasn't secured a better deal, residency deal, for migrant nurses to fill our worker shortages, this is what he said.
And that's probably better than people sitting in Wellington sort of, opining about, what may or may not be the case.
Seems a bit disparaging.
I can talk about the Nurses Organisation because they also claim about the need for more nurse pay. Nurses in New Zealand in hospitals right now would be on base incomes between $10,000 and $12,000 a year more had the Nurses Organisation not blocked the pay equity deal that they signed up to in December last year. You can understand that I find the Nurses Organisation, talking with a forked tongue on many issues.
Paul Galter's the CEO at the Nurses Organisation. Paul, forked tongues, what do you reckon?
Well, it's just not useful. And this claim about sitting in Wellington, what we've done overnight is we're encouraging our nurses all over the country to let the Minister know that it's not just sitting in Wellington, it's everywhere all over the country. And it's just got to be fixed, and arguing over words like crisis or whatever just seems to me really problematic. It's just a slanging match. I think we need to get on and fix it.
Yeah, do you think, tell me how your members, how nurses are feeling about that interview yesterday. What have they told you?
Well, they're really dirty on it because they think they've been trashed by their minister. And that's predictable. And it's not just in hospitals either. We're talking right across the board: primary health care, aged care, Māori and iwi, nurses working in that area. It's right across the board. And I've never known why it's useful to attack the spokespeople for a group of 55,000.
No. Let's talk about some of the issues, because this is what I was trying to get some movement from the Minister on, was filling these shortages. And there's things like the fast-tracking the migrant nurses so that they go straight into residency rather than having to wait 2 years. There's no movement on that, unfortunately, Paul.
No, and again, this is really strange. Doctors and engineers, they can all be fast-tracked through, but the front line of our health system, the nursing sector, is put back to level 2. And then we asked why, and we've got sort of policy making on the hoof, or as I say, someone said policy making, because ministers have been unable to point to evidence other than someone said to them. Now, why on earth would you regard nurses as a flight risk? They'll be a flight risk only if they're not paid what they're worth and the jobs aren't made attractive in this country, and that's not happening. Yeah,
I think the example the Minister gave yesterday for defending the policy was that he'd spoken to one guy in Manila who agreed with him. So let's talk about the pay very quickly, because this is central to what you guys have been talking about, Paul. The Minister has basically accused you of walking away from the deal that could give nurses an extra $10,000 to $12,000. Not technically true, is it?
It's not true, and this is a negotiation. We don't think the government delivered on one of its promises it's made about backdating of pay equity to DHB or ex-DHB nurses. The government say they did. So what do? You take it off to the appropriate authority, which is the Employment Relations Authority. This is using the government's own legislation to sort this out. I don't know why on earth the Minister would want to start criticising someone utilising their own legislation.